Welcome back. Well, like many other countries, South Africa has a deep love-hate relationship with alcohol. The sale of alcohol, which was initially banned, has been allowed since the start of lockdown level 3. Some researchers maintain alcohol consumption, particularly binge drinking, affects your brain, making it hard to think clearly. As a result, when you're drunk, you're more likely to make poor decisions that could lead or put your health and safety at risk. Before we discuss this further, we just want to mention now, we've invited a panel, but we also tried to repeatedly to get representatives from the alcohol industry to join the discussion. If they are listening, they can phone in and join in. But we have been able to bring in other stakeholders on this subject. Let's now talk to Coceka Nogoduka, Acting CEO, South African National AIDS Council, Steve Letseke, who serves as the South African National AIDS Council Co-Chairperson, and since the outbreak, Steve established and co-leads the Community Constituency COVID-19 Front that brings together 10 apex civil society networks in South Africa. As well as we have Reverend Bafana Khumalo, who is a member of the senior management team at Sonke Gender Justice. Thank you all for taking the opportunity. Welcome to the agenda.
Thank you for inviting us. It's a pleasure.
Ms. Nogoduka, if I may start with you. One of the main aims, I guess, for us this morning is to correct misinformation that is being spread through social media and other communication channels about COVID-19 and its relationship with alcohol. So talk to us about the general facts we should know about the consumption of alcohol and health as it relates to the coronavirus.
Thank you very much, and good morning to your viewers at home. As the South African National AIDS Council, you are aware that we are coordinating the HIV, TB and STIs response in the country. And over the years of us trying to make sure that we look at how do we fight HIV spread in the country, we then got to realize that alcohol is a contributing factor to the spread of the HIV virus. If you look at the National Strategic Plan that we are currently implementing, one of the goals is social and structural drivers. That looks at other key factors that are affecting the spread, the rapid spread of Reverend Bafana is the co-chair of that task team. Alcohol has been found to contribute to the spread of HIV. Alcohol is seen to be contributing to the increased GBV rates, which also circle back to increased HIV infections. Yes. So we are coming with that evidence to COVID-19 to say COVID-19 is a virus similar to HIV. COVID-19 has impact in the community, not only as an individual in terms of your health issues. We've seen the impact of COVID-19 on the communities. We've seen the impact of COVID-19 in the economy. We've seen the impact of COVID-19 rising issues around mental health and also contributing to how communities live, right, which is similar to how HIV has ravaged South Africa. So we are saying, based on the research that we've conducted as the AIDS community, we've seen that alcohol is a drug, therefore it reduces your level of thinking as indicated. So your risk inhibition is then reduced, which means you are then prone to taking risks when you are under the influence of alcohol. Within the context of HIV, we've seen that people who abuse and use alcohol are then get to engage in the risky sexual behaviors. They no longer using the preventative methods that are available to them because their thinking capacity and their level of making decision is then reduced with drinking alcohol. So we are bringing that as a lesson learned from the HIV response to the COVID response to say, let's not repeat the mistakes that we've done with HIV. To date, we've got about 7.7 million people living with HIV based on some of the issues that we never focused on when we were dealing with HIV. Right. We only focused on the health issue. But we want to say social and structural drivers of epidemics contribute to the spread of the epidemics. Hence our concern to say, while we're fighting with COVID, health promotion around COVID needs one to always be careful in terms of how you interact, where you breathe. Have you got your mask? Have you washed your hands? What surfaces you are touching? But then if we then throw in alcohol in that equation.
Let's just talk a bit more about this with Steve Letseke. I guess, Steve, we can't lose sight of the fact that preventing HIV is still important during a COVID-19 pandemic. Talk to us about the dangers associated with excess alcohol consumption.
As I've said, alcohol reduces the level of thinking and looking at the risk.
Yeah.
So your risk perception is then now reduced.
Right.
So we've seen when we go party, drink alcohol, we meet new sexual partners that we engage in sex with.
Right.
Because we are partying, we are having fun, you'd find that by the time you're meeting this one night stand or this one sexual partner, you don't even have a condom in your possession. Even if you have a condom, because now your level of thinking has been reduced by alcohol intake, you then no longer use the condom.
Ms. Nogoduka, let me throw that, sorry to come in.
Exposed to alcohol, you'll find in some places of
I'm not sure if we have an issue with our line to Ms. Nogoduka.
Start buying drinks for each other, and at the end of the evening, you're then exposed to gender-based violence, where the person that bought you drinks now feels that you have to also contribute by having sex with them. So for us, having sex gives you that opportunity to be able to take a risk, which then exposes you the following day. Either you have an STI, a sexually transmitted infection, you have contracted HIV, or you have unwanted pregnancy.
Steve, you with us? You can hear us?
Yes, I can hear you.
All right, let me bring you into the conversation with regards to the dangers of excess alcohol consumption.
Look, one of the things that we have seen, it's the increase of gender-based violence. The social element of it is that, one, the fact that we're putting vulnerable population who are already affected by many other diseases that Coceka has spoken about.
Yeah.
It's one of the biggest issues. We definitely know, and we knew, and we saw it, what happened in terms of the extreme level of intimate partner violence, the extreme level of rejection of family challenges. But also we've seen how much South Africans shifted their resources from getting essential needs like foods and so forth to buying alcohol. Now, it's not a problem to buy alcohol and to consume alcohol. The problem is the effect of alcohol and it has on society. Now, when you address social and structural drivers such as gender-based violence, hate crimes, and so forth, there's an impact or there's a side effect of it which is coming from alcohol consumption. But added to this, it's what happens to those who are drinking or consuming alcohol, which is one of the a pandemic that South Africa has been dealing with, which is issues of injuries. How many people were reported to have been admitted in hospitals? The fact that we are admitting people in hospital is because of drinking and driving. It's also because of that, people consume to an extent where they cannot even, control themselves. People are extremely drunk and they get blocked out and so forth. So which then flicks out into the health environment, and people are admitted in hospitals and clinics. But what also is the challenge that we have to think about? Those who are drinking and who have not tested or who do not know their status, particularly around the consideration of social distancing, the consideration of the health, COVID health-related prevention aspect. It reduces that ability to even protect other people from contracting COVID. But added to that, it's the ability. It's also multiplied by the fact that we are still fighting TB and HIV. Right. So these are some of the issues that we are battling with, that finds effect into social and structural issues.
Reverend Khumalo, let me bring you into the conversation. President Cyril Ramaphosa addressed the nation last week, and he said we need to examine the effect of alcohol abuse, not only on levels of violence, but also on road accidents and reckless behavior. And he also said that several international and domestic studies show clear linkages between alcohol abuse and gender-based violence. What does your research tell you?
Well, we agree with the president. I mean, the evidence is ample. Where there is access to alcohol, especially your emphasis, because I think it makes the point, access to excess alcohol is a problem. And show that in South Africa, we don't just have a problem of alcohol, we have a huge problem of what we call binge drinking. And binge drinking is people drinking themselves to a stupor, to a point where, as Coceka has said, the level of making a judgment call is limited and reduced quite substantially. And this is a major challenge for us because we already have high levels of gender-based violence in South Africa. Now, if you put access to alcohol, it implicates and complicates the problem even further. And this is the challenge that we are facing then in terms of how do we regulate access to alcohol such that we do not have to deal with the unintended consequences of what alcohol is visiting on the many challenges that we have.
Right.
I think COVID-19 by itself is a challenge. We have a challenge of HIV and TB, which we were managing. And I think when one puts alcohol into that mix, it really throws a spin into all our interventions and sets us back quite substantially.
Coceka, if alcohol intoxication is contributing to these crimes, as Reverend Bafana Khumalo outlined, what are some of the ways it can be best addressed with urgency?
As you are aware, the government has tried to put on taxes on alcohol, has tried to put age limit to alcohol, already working with the alcohol restriction agencies in the country. We've seen where we're trying to make sure that where alcohol is sold, not around the schools, not around the churches, the operating hours of alcohol selling places is being reduced. So those are some of the measures that government has tried to put in place to make sure that at least there is limitations around alcohol. Working with the Department of Basic Education and working with the NGOs that are contributing to some of the social and structural drivers programs within the SANAC structures, we've made sure that within the education sector, the comprehensive sexuality education program also deals with issues where within a classroom setting, there'll be teachings of alcohol, the effects of alcohol, starting at a young age for learners to be able to understand what is the impact of alcohol. NGOs that are working in the space have also tried to make sure that there are community interventions and community programs that are teaching how to deal with alcohol, what are the effects of alcohol. The Department of Social Development has put programs in place to make sure that we rehabilitate people that have been drinking alcohol and accessing alcohol, and they already have fallen into the space of being alcoholics, which is a disease in itself that needs to be addressed. So those are the measures that we are trying to put in place. I think Reverend Bafana will talk also in his capacity within the faith-based sector, the programs that the church is also getting into in terms of teaching communities, but also going out into the communities and also making sure that communities are not dependent on alcohol, and what alcohol does in terms of also looking at impact of alcohol within the family.
I just wonder in terms of the current restrictions that has been imposed under level 3 with regards to the sale of alcohol, and what you mentioned as well, Monday to Thursday, the limited time as well, how this would affect the industry if this has to remain. We did reach out to a number of representatives from the alcohol industry to come and join us onto the program, but to no avail. But we will still try and get their reaction. Steve, what lessons can be drawn, do you think, from this lockdown in terms of how we can best protect our society from the abuse of alcohol?
The lessons, as Dr. Guy has said, one, it's education. I mean, if we speak about the long-term or short-term and long-term effects, of alcohol, on an everyday life, we have to know what it does on organs of the body. We have to understand what level of compromise that does alcohol have on the immune system, and not only just for citizens who don't understand even the multiple co-infections, one of COVID or even of HIV, because the immune system is needed even during this time of era or of pandemics. But also beyond education, it's understanding some other effects where, one, how does alcohol, alters thoughts, judgment, decision-making, and behavior? And we really need to look at preventative measures, from policy to action. Exactly one, limiting some of these times that Coceka has been talking about, but also the risk factors that affect society as a whole, from violence, from, exposing people to vulnerability. So for me, I think it's quite important that we look at education, we look at rules of engagement in society, but also we make available resources, because ultimately, if we do not ensure that police are where they need to be also be effective and functional in responding to challenges. The healthcare system does not take in considerations, or the current health system, the way it's overburdened even by COVID, that it does not take in consideration the added effects of those who are coming with injuries, as we've seen since the lockdown level 3 has come into place. But similarly, who else are we exposing to vulnerabilities and also to the very same effects of alcohol? So for me, education, prevention, but also response, it's quite important in the alcohol system.
What is your research telling you, Steve, with regards to the taking of ARVs as well as being intoxicated? Are you likely to once you're intoxicated to forget about taking your dose?
Well, I mean, look, we have to check if there are studies where we've seen, a number of challenges that speaks to taking ARVs and also taking alcohol. But I think that also will be, affected by the idea of how alcohol on its own alters the thoughts, the judgment, decision-making, and behavior. But also is that even if you do not forget to take your ARVs, what is the alteration level between alcohol take and also of HIV? I'm sure Coceka can expand on that. But one thing that we know very well, it's beyond just the intake, it's the behavior that we are still struggling with, is that, the fact that you're more likely to forget using a condom, or you're more likely to be unable to negotiate condom, and which then spills over to the effect of infection rate. It also spills over to the fact that your intake of treatment, but the behavior then of getting out of the idea of respecting even others when you are more likely to be exposed to sexual encounters.
Coceka, what's your take on that?
Just to add, to say, if you're looking at our HIV stats, you'll find that adolescent girls and young women between the ages of 15 and 20 and 29 are the most vulnerable to HIV. They have highest HIV infection rates. And then you take that number, and then you also look at the vulnerability of young people in the country that are unemployed. You look at the needs of women in the country. You also then look at issues of age, disparate sex, where older men are having sexual relations with younger women. So already that puts them at a vulnerable stage. But if you also track the trends around alcohol use and alcohol consumption, you would see what we call norms change, where women and young women are more prone to be drinking alcohol and are more favorable to issues around drinking alcohol as they are growing up. So that is our concern, to say, as young women, you look at the vulnerabilities of being a young woman, just normally in South Africa, looking at issues around high GBV incidence, you're looking at issues around high intimate partner violence that these young women get exposed to. You look at issues where women are then not working, and then for them to be able to get money, then they depend on sexual partners who are older than them. Then you throw alcohol in all of that equation. So you are sitting with adolescent girls and young women who are unable to negotiate safer sex, who are unable to negotiate their rights because of one virtue of being a woman, but then it's inhibited by the use of alcohol.
Coceka, you speak about GBV. Sorry, we have to go on to the issue of GBV. We're fast running out of time. Reverend Bafana Khumalo, I want to talk to you very quickly about toxic masculinity, and I guess it stems from teaching boys that they need to repress their emotions. They need to act in an aggressive, dominant way, that anything other than that makes them weak. I mean, it can manifest itself in acts like bullying and catcalling. What is the best way to get through to men, to abandon the boys will be boys mentality, and instead hold other men accountable for misogynistic attitudes and behavior? What's your thoughts around this, very briefly?
Well, I think this is where the industry needs to come to the party, because some of the messages that are sent through, either through adverts for alcohol, actually regurgitates these dangerous norms of what it means to be a man. I mean, strong men are always exemplified as those who can drink, and drink a lot, and drink too much alcohol. And that is shown to be almost a positive virtue of what it means to be a man. And so we need to have our inputs, as Steve has said, on prevention, how we educate our boys around these issues, to indicate that manhood is not about showing, aggression, showing aggressive strength in order to prove that you are a man. In how we inculcate the values in our socialization, there's also this element that you need to be a certain age of a man in order to exemplify a particular attitude of manhood, and therefore you can qualify to drink, for instance, and to do all sorts of things. And that those kinds of messages, sublime as they are, send this notion that says manhood is identified with access to alcohol and abuse of alcohol, because then you have arrived, you're a man, about town. We even have such awards as give this man a bells, because he's supposed to have done something extraordinary. And this, for me, is part of the problem, because then it sends this message, this notion of a manhood being identified with alcohol and use of alcohol. And we see the implications of that. Once people have taken alcohol, forget about people remembering to wash their hands. Forget about people being careful about touching spaces carefully. Forget about people putting up their masks when they've had an excess amount of alcohol. So we need to really go back to the drawing board and say, given these many challenges that we are facing, COVID is a major challenge for us, but we cannot add issues that are actually not helping us deal with this challenge, like alcohol, which actually takes us back. We need to be able to say, how do we deal with challenges of toxic masculinities, where you are able to talk to men to say, this is not the way to behave. But somebody who has taken alcohol, it's very even difficult to even reason with them, because even the level of engagement may itself spark more violence.
Reverend, we have fast run out of time.
That which may cause, escalation of the problem in the picture, so that we can have a fresh conversation with men to say these things are not correct. We need to behave differently as men.
We got to go, but look, 25 minutes is still not enough to explore these issues. No doubt we'll bring you guys back. And no doubt the road, as the president said ahead, will be long and difficult, and the task of recovery will be considerable. But we thank all of you for your insight and perspective in trying to, steer us in the right direction. God bless, be well. All right.